last year, Henry Schein took part in the Ambulatory Surgery Center Association National Advocacy Day on Capitol Hill, where we, along with other ASCs, met with policymakers to ensure that the voices of ASCs were heard. You guys did a great job, as always, hosting that event. Very worthwhile event to participate in, and we really enjoyed being there. And we'll be there again this year to help support and sponsor the event coming up. So, David, having said that, tell us about the ASC industry. What is an ASC? How does ASCA, the association that you are a part of, how does ASCA support the ASC industry?
Scott, thanks so much for having me. And thank you to Henry Schein for supporting us on our National Advocacy Day coming up in February. Ambulatory surgery centers have provided high quality care and cost savings to patients and healthcare payers since their inception more than 50 years ago. We save Medicare billions and billions of dollars by basically operating at 50 cents, more or less on the dollar per procedure. And we're able to do this because we have effective teams who really just specialize in, a number of procedures. And it almost is like a conveyor belt. I know not everybody loves to hear that in terms of human beings, but in terms of their effective and efficient process of getting a patient in and out the exact same day. And so ambulatory means outpatient for, more or less. It means to, be able to leave the same day when you have. And ASCA has been around for, I believe, 25 years or so. We are the only association that is collectively working to benefit every single ASC in the United States and really in the world. We argue at the federal level, we argue at the state level, why we need to, be supported more by the government in terms of our effectiveness, in terms of our ability to help healthcare save money and move patients to not only a lower cost setting, but places where we know that the teams are effectively the very best at what they do.
Yeah, that's great to hear, David. And talking about advocacy and the work that you're doing coming into this year, what are you most excited about? What do you think is top and center as far as what you want to get accomplished and where you get excited?
Well, we have a provision of our bill, the Outpatient Surgery Quality and Access Act of 2023, HR 972 in the House and S 312 on the Senate side, that really has been implemented, 3/4 of the way at the executive level through CMS and tremendous work. And we have a particular provision, the copay cap issue, that we think is very meaningful, could save Medicare billions more dollars, and speaks directly to an issue, site neutrality, that we have known for months is going to be at the forefront of the conversations in Congress in February and January, when the next continuing resolutions are going to be kind of determined.
Yeah, and that Medicare Access Act, very important act. I know that's top and center within the association, the work you're doing there. So we're hoping for a positive outcome there. If you think about the future, David, and if you look in your crystal ball and you think about some of the important opportunities for the industry, what are your thoughts there?
Well, I believe that we're at a critical juncture in terms of ASCs being so critically involved in all of the discussions on price transparency, cost reporting, site neutrality, and a slew of other issues that are being discussed at a high level in committees of jurisdiction. So in the House Energy and Commerce, Ways and Means, and in the Senate Finance committees. And, to be quite frank, it looks like there's going to be some law, just like the No Surprises Act, that is going to touch us. But in the middle of all of that, we've been able to make connections and have strong discussions about how ASCs need to be seen more valuably to the government in terms of how we're able to save money and how access for more patients to ASCs would be tremendously helpful in not only saving money, but saving lives ultimately. We believe that we provide a space that is, truly more inviting and less stressful. Your family can join you for the entire process, obviously not during the actual surgery, but can be in the waiting room and not feel like they're in an overcrowded emergency room or something like that, or in the operating room being right down the hall from the emergency room. Coming out of the pandemic, I think that it's clear that ASCs offer a space that is less concerning in terms of exposure to risk of infection or communicable diseases like COVID. And we know that our patient outcomes are the same, if not better, for procedures where we're saving the government tons of money if they're able to get more patients to come, particularly Part B Medicare patients. So we think that we have great public policy to put forth. And, with all of this groundswell of support that we're getting from our members and from our affiliates like Henry Schein, I really think that Congress is paying attention.
Well, that's exciting to hear, David, and we appreciate the work you guys are doing there at ASCA and the work you're doing on Capitol Hill. It's important, very, very important for the industry, and we appreciate you articulating the value that ASCs bring to us as healthcare consumers and to our healthcare economy. Great quality care at a fraction of the cost. It's great for all of us as healthcare consumers. So thank you for articulating that. Thanks for the work you do at ASCA every day. Thank you for joining us on this Schein Chats today. And for those of you listening in, we welcome you to join us on future Schein Chats. Thanks for joining. Take care.